Just as a reminder for the audience, please be sure to type your questions, if you have any, into the question box in your control panel, just to have an open discussion after the presentation. And now, the last speaker, not the least, but the last speaker only, it's my great pleasure to introduce him. It's Fabio Guarracino, who is head of the Department of Anesthesia and Critical Care Medicine, and Director of Cardiothoracic and Vascular Anesthesia and Intensive Care at Azienda Ospedaliero Universitaria in Pisa, Italy. He's an active member of several scientific societies, and he is the president of the European Association of Cardiothoracic and Vascular Anesthesiologists. He's member of and reviewer of several editorial boards. He has published in several peer-reviewed journals and was invited speaker at a lot of international meetings. And he will talk about how to reduce the risk, intraoperative and postoperative tips. Thank you very much. Please, Fabio.
Thank you so much, Laszlo, for your very kind introduction. So, how to reduce risks? I will try to give some tips regarding the intraoperative and postoperative strategies to reduce the risks during this resuming phase. Well, I have no conflict of interest related to this presentation. So, where do the risks come from, both intraoperatively and postoperatively during this time? Well, basically, they come from the COVID-19 virus, as we all know. And so what we should mainly take care of are the aerosol, the so-called aerosol generating procedures. And we know that anesthesia staff in particular performs many of these risky procedures, but also the lung surgery, the lung resection, or the lung damage during an intrathoracic surgery can also expose the staff during the operation to the risk of viral spread. So the air-generating procedures are, I would say, quite a long list. Most of them belong to the anesthesia practices like intubation, extubation, the transesophageal echocardiography, the non-invasive modalities of ventilation, but also bronchoscopy and tracheostomy in the intensive care are considered high-risk procedures, as they can really generate the aerosol. So depending on the type of procedure and the setting where we perform those procedures, we should be very well aware that depending on the particles that are released during those procedures, so small or maybe bigger particles, we can have an increased risk coming from droplet rather than aerosol during these procedures. Now, very recently, and it is a pleasure for me to show you this paper, the Thoracic Subspecialty Committee of our association of EACTA published this preliminary recommendation for the management of the airways during thoracic surgery. And in this manuscript, we, and I say we because I have the honor and the pleasure to be one of the authors, we gave suggestions also regarding safety during anesthesia. And so some of the tips I'm going to show you come from this EACTA manuscript. So, of course, one of the most important things that we should consider both during and after surgery to protect the healthcare providers is related to wearing the PPE. This is something very important. A full PPE equipment should always be worn and should always be available, going from hair cover, face masks, the eye protection, so face shield or goggles, the fluid-resistant gown, the double gloves, the overshoes. So this is something that I am pretty sure that everybody has experienced over the first pandemic phase. But regarding the intraoperative phase, I would say that the preparation of the patient, so the anesthesia induction and all the anesthesia maneuvers during the preparation phase should be accomplished in a negative pressure room, which is a room with more than 12 air cycles per minute, negative pressure inside, which is very useful to protect people who are outside the room from the risk of the virus exposure. Of course, during the preparation of the patient, during the anesthesia induction and all the anesthesia maneuvers, all the other staff members, and I mean surgeons, nurses, perfusionists in the cardiac setting, should wait outside the room until the airways have been secured. And this is something very important to consider, because as I showed you a few slides ago, most of the aerosol generating procedures are performed exactly during the preparation of the patient inside the theater. Should a negative pressure room not be available, and then all the maneuvers should be performed in a positive pressure room, well, the pressure inside the positive pressure room should be the lowest, so that by keeping the door closed, the high exchange rate of the air in the operating room will not cause dispersion of the aerosol outside the theater. So this is something that we should keep in mind, because I'm pretty sure that not everybody has negative pressure rooms to perform the anesthesia preparation. One of the tips that we have learned from the literature, and I would say also from our own direct clinical experience, is that all the machines, all the anesthesia machines, the echo machines, the point of care, the computers, everything we use in theater should be protected with transparent plastic sheet, transparent sheets covering all the stuff we use inside the surgical theater. Well, I think that also having a sophisticated organization, team practices, is really very important. And one of the most important things I personally learned during the first hit of the pandemic was that we should always keep in mind that minimizing the number of the staff people exposed to the risk of viral spread is very, very important. So, and when I say the number of staff members, I refer to everybody working on the patient. So anesthesiologists, surgeons, perfusionists, nurses, and so on. And one more point that I would really underline here, because I consider that very important, and again this comes from the experience during the first hit of the pandemic, is that we have to do any effort to improve our communication and make it stronger and more effective, because as we all could experience, communication is very difficult when we are wearing the PPE in theater and also in the intensive care. And this is something that we should consider very seriously, because sometimes this really carries troubles during